you about medication. So I went to the doctor about a week ago, and as I hurt in my legs, this is why I move a lot. I dance, I have to move, I'm constantly dancing and moving. But I went and had a blood test and all that good stuff. So, number one, I have 7 medications. Do I really need all 7 medication? Y'all come join me and tell me, do I really need all this medication? I don't think so. But I'm going to read you off all the medication that my doctor gave me. Bear with me. There's some words that I can't say, so bear with me. And I have to see. Number one, this is vitamin D, vitamin D2. It may cause a little nauseous, but vitamin D2 is good. So this is a plus for me. Vitamin D is for your bones and stuff like that. Okay. Now we're getting into the goodies. Number 2. This is called, let's see if I can pronounce it, y'all. Amlodipine Beslate. Okay. I will spell it out due to the fact that I cannot pronounce it very well. AMLODIPINE BESYLATE. This is a prescription for calcium, a channel blocker to treat high blood pressure and chest pains. Yep. Okay, I'm not having chest pains. I did not go to the doctor for chest pains. It's a blocker to treat high blood pressure. Yes, every now and then I have high blood pressure, but let me tell you something about high blood pressure, y'all. You know, you go to the doctor, you know, your heart's going 100 miles an hour and you don't really want to go to the doctor, but you do. Usually when you go to the doctor, your blood pressure when they take it is high. Usually, you know, it's a little high because your anxiety and all that good stuff. Yes, mine, every time I go in there, it's usually about 150 over 90 something. And they'll let me sit there for a little while. And when I sit there for a little while, it goes down. It goes back to normal. 130 something over up to 20 something. You know, to me it's normal. To me it's normal. Okay, so I'm not having chest pains. I don't think I have high blood pressure like they say I do. Now, if I was to take this, the side effects is known as anorexia. It can cause ankle swelling, dizziness, flushing, and fatigue. Now, I don't think I'm going to take this, but I will be reading more on it and make sure, but I don't think I will be taking this. Number one, I am not having any heart issues that I know of, maybe a little high blood pressure here and there. Okay, that's number 2 pill. Y'all bear with me now. Number 3 is, let's see, number 3 is this right here. I have 3 of these. I have 3 of these. Number 3 is called, let's see if I can pronounce it, methocarbamol. METHOCARBAMOL. It is a prescription for muscle relaxer used for painful muscles. When you want to relax, your muscles are hurting. Now I got 3 big old bottles of these. That's a lot, y'all. That's a lot of muscle pain. The side effects on them is drowsiness, dizziness, lightheaded, nausea, upset stomach, and blurred vision. Will I be taking this medication? Probably not. Probably not. I wish I could pronounce it. Methocarbamol. And like I said, it is a muscle relaxer. I will think about it, get with other people and see what this is all about and take it from there. And y'all give me y'all input. Oh, and by the way, I guess I should introduce myself. My name is Wanda Sue. I'm from Jacksonville, Florida. And I just came on here to YouTube so I can let people know you don't have to take all this medication. There's things out there that you can do to help yourself. Okay, this is number 3. Let's get on with number 4. Now, this is the doctor's prescribing me all this, y'all. Number 4. Let's see what number 4 is. Actually, okay, this is called, this one is called, y'all, I have them all mixed up right here, but I found it. Okay, this one is the omega-3 acid. Okay, omega-3 acid, such as Loavanza, is to strengthen fat deprived from fish oil. They are alongside a healthy diet and exercise to lower very high blood tricycle levels. And it's fats in the blood. So, omega-3 acid may be good and may not be good. But the side effects of that is burping, upset stomach, and a little nausea. And who wants that? Okay, so anyway, omega-3 may be good, maybe not. I will look into that myself. Okie dokie, what do we have here? I got some of these a little messed up, so let's see here. We are going to do the it is called atorvastatin. Atorvastatin. Vastatin is to lower bad ELD cholesterol and your tricycles while raising good HDL cholesterol. At risk of heart attacks and strokes. Okay, the side effects on these is muscle aches, joint pain, diarrhea, upset stomach, serious risk, severe muscle breakdown. So this I don't think I'm going to take, but I will look into more about it because there's things that I can do to get your LDL and all that lowered. And that's exercise, stop eating like I do. I eat a bunch of junk because I am addicted to sweets. And I think I have to have something to eat every night that's sweet. So I don't think I will be taking this, but this is something else I'll be looking into, y'all. Bear with me. Okay, now we got this one, and this one is oh boy. Where is the Melicam? It is called Meloxicam. 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 It is a prescription, non-sterile. It's an inflammable drug, as an NSAID. Inflammable drug. Used to treat joint pain, swelling, and stiffness from osteoarthritis and rheumatoid arthritis. Now, I do have osteoporosis. I have osteoarthritis. I have rheumatoid arthritis. So this may and may not be good for me. I will look into it more about it. Meloxicam. Like I said, it may be good. Used to treat for joint pain, swelling, and all that. But like I said, I may not take this either. So I will be checking into that too. Okay, what do we have here? Maybe one more? One more. 3 boxes. 3 boxes. And this is a... Oh, goodness. I had to write everything down because I just cannot remember all of it. Just too much medication for me, y'all. I think it's just too much medication, and I can do things different to help me. You know, to help myself. Don't y'all think? Okay, this one is the... Well, I said, I think I already done it, y'all. Yep. So, 1, 2, 3, 4, and then 5. Oh, here we go, 5, 6. Yep, okay, I think I have it all. I believe I already told you about the alendronate, the 70 milligram. I'm not sure, but I will repeat if not. This is a prescription to prevent osteoporosis and post-menopausal for women and men, or to treat bone loss. And it helps chance of fractures. Now, this may be good and it may not. Now, I have read the side effects on this one. The side effects is, it's also called Fosamax. Now, I'm sure everyone has heard of Fosamax. It's a mild, you will get heartburn, stomach pain, nausea, constipation, diarrhea, joint aches, and headaches. That's the side effects, y'all. So you see, y'all, all this medication that my doctor has given me, all these medication these doctors given me, I do not need. You know, this is it's just ridiculous to have that much medication. Yes, some of you do need medication. Absolutely, you need to take your medication when he prescribes you medication. But if you feel that it's too much medication, don't take it. There's things that you can do, y'all. There is things that you can do. Number 1, I admit, I am a sugar addict. When I eat dinner, and that's another thing, salt, pepper, seasoning, I love all that. And I still do it. My sugar, oh, yum, yum. I have to have sugar every night. I either cinnamon rolls, a cake, anything chocolate, anything sweet. Every night I eat. And I can cut that down. Y'all need to cut that down. If your cholesterol's high, try not to eat as much. Try to eat more greens, more vegetables, more vegetables, and eat right. No, I don't eat right because I'm a pig and I love to eat anything. So that's one thing I have to work on. I have to work on this really, really hard because it is an addiction, a sugar addiction. So, And as far as joint pain, osteoarthritis, yes, I have that very bad. I have osteoarthritis in my hands, uh, back, everywhere. And I will give you a little demonstration if you can see, y'all. Do you see my pinky, how it's bent? I cannot straighten it out like most people do. It's osteoarthritis. And it's okay to take medication for your osteoarthritis because osteoarthritis is very painful. So is rheumatoid. Rheumatoid is where your hands and all will just, like that. Well, I'm not there, but I do have osteo. And it's very painful. And what do I take? I take Tylenol. I take over-the-counter stuff. I do not take all of this medication. All this medication, no, I do not. I think oh, and by the way, the vitamin D, I did tell you that I was going to take my vitamin D too. Yes. I will continue to take the vitamin D2. And once that is over, prescription is over, I will go over the counter and buy me some vitamin D with K. That is very important, y'all. I have learned this. Vitamin D with a K in it. So after this is gone, and the only reason I'm taking this is because it's good for me. I'm very low. I'm very low on everything, so I will. It's just too much medication, way too much medication. So what do y'all think? Help me out, y'all. Leave me some comments. Should I take all this medication? Look, should I take all of this medication or just throw it all away? I say throw most of it away and keep the ones that you really, really need. Just take care of yourself, y'all. Me, I'm going to try. I'm going to do my best, do everything I can to stay away from the sweets and eat right and exercise. Exercise is very important. This is why I dance. People say, how do you do it? Let me tell you, I love to dance. You have to move your body. I am single. I go out with the girls. I go out with my family, my sister and her boyfriend, and I dance. I love to dance. I have been at dance clubs, dance places. I love to dance. So I keep my body going and dancing. Ballroom dancing. I love it all. So just keep moving, y'all. You don't need all this medication. Keep your body moving. Do some dancing. And I dance alone now. Well, I have my friends I dance with, of course. But I did have a partner, and my partner passed away a couple of years ago in a car accident. So I don't go out as much like I used to. We used to go out all the time, every weekend. We used to dance. We'd go, I'd play my tambourine, back up, sing a little, and I just had a blast. But he is gone now, and I started staying home and not going places too much and started eating. Eat. Okay, so doctor says stop eating so much and lay off the sweets. Get back to my dancing, which I do. I am going back to, my friends. We go to the bars and we dance. I do not drink. I am not a drinker, never have been, but I love to rock and roll. Yes, I do. I love to rock and roll. I love my country. I'm a rock girl. I love it all. Well, I don't know how much time I have on here, but subscribe to my channel. Maybe I will keep you updated on some of these nasty pills that the doctor gave me. And come hang out with me. I am a granny. Yep, I am a granny of 10 with 3 granddaughters, step granddaughters. So they come over a lot. I love my grandkids. They come over here. We cook. I'm a cook. I love to cook. Sometimes I get lazy and don't, but I love to cook. And the grandkids come over and they love to cook. And they help me, and we just do what we have to do, y'all. We are a family. Well, y'all come join me on the next whatever I talk about. Oh, there is a lot I'd like to talk to you about. Maybe the next one is respect. I have a lot to talk about respect and toxic people. Would y'all like to hear about toxic people? Because I know some toxic people. Well, what do I make for my grandkids? Well, my grandson is 17, almost 18, and we looked up on, I think it was YouTube or TikTok, and they called muffins. We make these little muffins. I'll try to explain how I do it. We get these like little tiny the pans like you're making cornbread, and we scramble up some eggs and make some bacon, and we put hash browns in it. And once the hash browns are in it, we put it in the oven for a few minutes, bring it back out. We take a glass and we smush it down. I know it sounds funny, y'all, but we smush the hash browns down. And then the bacon's already cooked, so we throw the eggs that we whip up the eggs and we pour it on top of each one of them. Then we scramble up the bacon on top of it. Then we put cheese on top of it. Then we put it in the oven and wait till it's done, and it is